So I would like to welcome our most distinguished guests, our heads of government, excellencies, many participants from around the world, to this side event, which is convened by the Global Leaders Network and by the Africa Leaders Malaria Alliance, together uniting world leaders for global health security. We're meeting, obviously, during the 80th United Nations General Assembly, and this is the third consecutive year which the Global Leaders Network has had a role in convening this meeting. When it convened first only 2 years ago in the UNICEF building, there were only one head of state, one head of government present. President Cyril Ramaphosa, who leads the Global Leaders Network, and Prime Minister Mette Frederiksen of Denmark answered the call today. Thanks to President Ramaphosa's considerable recruitment efforts, we have 11 heads of state in the network, a clear sign that this is gaining traction and political momentum. And with today's joint gathering with the Africa Leaders Malaria Alliance, this momentum takes a bold new step. But as the coalition around women, children and adolescent health grows stronger, indeed so are the challenges growing greater, and indeed the challenges to the health security of all of us. We confront a convergence of crises, of escalating conflict and geopolitical tensions, of climate-related disasters, and then that global funding squeeze and a worrying erosion of solidarity which threatens hard-won progress. So these realities are why the Global Leaders Network and the African Leaders Malaria Alliance have chosen to join forces at the General Assembly here today, focusing together on bold actions from recommitting to the fight against preventable deaths and malaria, to tackling the global health financing crisis and ensuring that even in the most fragile contexts, women, children and adolescents can access the health services and protection they deserve. I extend my heartfelt gratitude to all in the Global Leaders Network and African Leaders Malaria Alliance and our distinguished guests. Your presence sends a very clear message. Health is not just a moral imperative, it's the bedrock of our peace, our security, our sustainable development. If we fail women, children and adolescents in times of crisis, we risk losing the very future we seek to build. So, to formally welcome us and set the stage for this historic joint event, it's my great honour to invite the Chair of the Global Leaders Network, His Excellency President Cyril Ramaphosa of the Republic of South Africa, to address us. President Ramaphosa, please come.
Thank you so much, Moderator. The Right Honourable Helen Clark, who has been a great inspiration in demonstrating her total commitment to the work that we are doing. I'd like to extend my greetings to President Duma Boko, President of the Republic of Botswana, and the Chair of the African Leaders Malaria Alliance for joining us, and Your Excellencies, Ministers, Deputy Ministers, and leaders of various organizations, funders, as well as many other non-governmental organizations who are here. It is a real joy and pleasure to have all of you here. It does give me a great deal of pride to co-host this very important event with President Boko. Today we stand together, in some ways united behind a bolder global health security agenda. We intend to move forward collaboratively to protect and preserve the health as well as the well-being of the most vulnerable populations all over the world. Over the past 3 years, the Global Leaders Network has established itself as a united force of sitting heads of state and government to improve global health. And I'm particularly delighted that a number of my colleagues, my brothers and sisters, heads of states and heads of government have agreed to be part of this very noble effort. Much as they are not here, they are participating with us in leading this whole effort. Our focus is on the health and the well-being of women, children, and adolescents across the world. The Global Leaders Network has been building consensus on various solutions to the most pressing problems facing global health today. Since we met last year on the margins of the United Nations General Assembly, the challenges are escalating. Conflict, displacement, economic shocks, and the climate emergency have in many ways reversed hard-won gains in health and development. Women, children, and adolescents, those whose well-being defines the future of every society, are bearing a disproportionate burden of the problems that the world faces. The international community pledged through the Sustainable Development Goals to end preventable maternal, newborn, and child deaths, and to secure universal access to sexual and reproductive health services by 2030. While significant progress has been made, survival gains have stalled since 2015. Unless we take bold actions, it is estimated that 60 countries will fall short of meeting the Sustainable Development Goals target for the under 5 mortality, and 65 countries will not make or achieve the SDG target for neonatal mortality. Over 700 women die every day from preventable diseases that are related to pregnancy and childbirth. And they die every day. Many of these women are adolescent girls. Complications from pregnancy, including unsafe abortions, are the leading cause of death amongst girls that are aged 15 and 19 years. Behind every number is a family that is torn apart, a community that is destabilized, a future that is cut short. The cost of inaction is simply staggering in the way where these lives are lost and the lost potential. According to McKinsey and the World Economic Forum, closing the women's health gap could generate up to $1 trillion annual boost to the global economy by 2040, while delivering tens of millions of healthier life years. This underscores the huge return we forgo when we fail to invest. A great concern of the Global Leaders Network, which we share with the African Leaders Malaria Alliance, is the sharp withdrawal of official development assistance for global health. Since last year, many critical programs for women's and children's and adolescents' health have collapsed or face severe cuts. Immunization campaigns are being scaled back. Maternal health services are closing. Adolescent sexual and reproductive health programs are also disappearing. Essential programs to eliminate malaria have been compromised. This leaves millions without care and erodes decades of progress that has been made so far. All this unfolds against a backdrop of intensifying conflicts. Wars destroy clinics and hospitals, and in a number of cases we have seen how clinics and hospitals have been targeted for destruction and for bombing. All this also disrupts supply chains for essential medicines that are not able to reach the people who need them most. And all this, the wars that is, expose women and girls to heightened risks of violence, such as rape and great abuse and trafficking, as well as exploitation. In 2023, countries with humanitarian response plans, which include fragile and crisis settings, accounted for about 64% of global maternal deaths, 50% of newborn deaths, and 51% of stillborns. The Global Leaders Network is dedicated to building global ties and strengthening cooperation between and within countries. To this end, we are delighted that we are able to demonstrate a united front between the Global Leaders Network and the African Leaders Malaria Alliance. In July this year, President Duma Boko of Botswana wrote to me to suggest that we work together on a gap financing mechanism for global health to address the cuts in official development assistance. President Boko will talk more on this today and the steps that will be necessary to close the health financing gap left by the withdrawal of much official development assistance. As the Global Leaders Network, as all of us gathered here today, let us reaffirm our commitment to 3 priority areas: increasing investment, universal health coverage, and upholding sexual and reproductive health rights. I wish to convey my sincere thanks to everyone who is present here today. And today is unprecedented in the sense that we've got so many people gathered here who are interested in the work that we continue to do. This signals in many ways a strong and sustained commitment to women and future generations, the generations that will be responsible for growth, for progress, and for shared prosperity. We look forward to productive deliberations, but we also look forward to bold commitments and determined actions that we all should take. Bold actions that will address the challenges that women girls and adolescents are facing with regard to their health. So we all have an important responsibility, not only as governments, but also as various key stakeholders in every country of the world. So I thank you, and I want to especially thank our moderator here, Right Honorable Helen Clark, for her continued commitment in this work. In fact, without her providing the inspiration that she continues to give to this work, many of us would not be able to have the energy and the stamina that she is inspiring us with. So thank you very much, Helen, for all the work that you continue to do. Thank you all.
Please stay, and can I ask the other presidents present to come and join you so you're not lonely? So please come forward, other presidents, and we will introduce you one by one. Thank you so much, President Ramaphosa, for setting out the issues so clearly.
Did you see the President of Kenya?
Yes. And thank you for setting out so clearly the issues we face at the moment, not least the seriousness of the financing gap. Thank you. So our next head of state presentation will come from His Excellency President Duma Gideon Boko, who is chair of the African Leaders Malaria Alliance and, of course, the President of Botswana. President Boko, the floor is yours.
Well, thank you very much to our gracious moderator, in whose debt we all are. We thank you for the great work that you do, the inspiration that you have been and continue to be. Let me recognize each and every one of you and thank you for being here today. Appreciate my good friend and neighbor back home, the President of the Republic of South Africa, President Cyril Ramaphosa. We also acknowledge gratefully the President of the Republic of Kenya, and appreciate once again each and every one of you. I approach the task I have to execute with a sense of dread and anxiety, sense of solemnity because of the enormity of the task itself, the challenges that we have to wrestle with. As we are all aware, the fight against malaria is becoming increasingly complex. Shrinking budgets, rising biological resistance, humanitarian crisis, and the impacts of climate change are all contributing towards creating a perfect storm of challenges. I call on all countries, donors, to invest boldly in the global fund replenishment and appreciate that if we all come together, we will save 23 million lives from malaria, from HIV, AIDS, and TB, while strengthening our health systems. We must also widen the pool of resources available for malaria by embracing innovative financing approaches. Many countries in Africa are already leading the way, creating national budget lines, establishing sanctuary taxes, and utilizing debt relief for investments in malaria and neglected tropical diseases. As ALMA, we are calling on the World Bank International Development Association funding to establish a second malaria booster program across Africa, and malaria councils are being established using scorecard tools to inform progress, measure impact, and identify investment gaps. Investment in 11 countries have raised over 150 million US dollars, proving the power of multi-sectoral collaboration. These decisions are guided by strategic data using subnational tailoring for the implementation of the most impactful intervention packages. The pipeline of innovations has never been stronger, and with manufacturing happening in Africa, these tools will not only accelerate growth, they will assist eliminate malaria. I urge African countries to take ownership of the research and introduce these new tools early by strengthening their regulatory capacities as well as signing and depositing their instruments with AMA. Whilst all these actions are required, they will not be enough. We must go beyond this, think bigger, casting our net wider to mobilize even more resources to respond to the critical health challenges of the most vulnerable in our societies. These are women, babies, children, adolescents, and marginalized. We need to come together as the South, working in a win-win partnership with our friends in the private sector, all our major investors, and with our brothers and sisters in the diaspora to create a new financing vehicle for our people. We need a private-public partnership health accelerator that will drive whole-of-society progress towards the SDGs through sustainable, high-value health investments. And for us in Africa, this will help us deliver the Africa we want. I'm calling on all heads of state and government, whether present here today or not, all leaders in the South, all private sector investors in the South, you, my brothers and sisters in the diaspora, come and join us. In malaria, we are calling it the big push. For every woman, child, and adolescent, it is a fundamental and basic human right. Let us leave here today with renewed determination. We need a health accelerator, a strong, sustainable partnership for prosperity with the private sector and the diaspora. Let's make political commitment and commit to being held accountable. We can make malaria elimination a reality. We can deliver a healthy tomorrow for women, babies, children, and adolescents. The time to start is now. Thank you very much for the privilege of your company here today. Thank you ever so kindly for the pleasure of your attention. Thank you very much.
Thank you, President Boko, and we heard your rallying call, the big push on malaria, and well noted, many important points made. I'm now going to call on His Excellency William Ruto, President of Kenya and a member of both these networks, Global Leaders Network and Africa Leaders Malaria Alliance. President Ruto.
Excellencies, partners, and friends. The subject before us is one that touches the heart of our people. The question is no longer whether Africa can finance its own health systems, but how quickly and decisively we do so. For decades, Africa's health gains have been supported through international solidarity. We remain deeply grateful for this partnership. Yet, as we look to Agenda 2063, our shared vision of a healthy and prosperous continent, we must confront the clear reality that Africa cannot build resilience on borrowed solutions and borrowed resources. The future of Africa health financing lies in our own hands. Encouragingly, across the continent, change is already underway. From maternal and child health to the fight against HIV, TB, and malaria, we have made some progress, but the task ahead remains and demands more. Malaria, in particular, must be eliminated from Africa. Kenya remains fully committed to the African Leaders Malaria Alliance and to the Zero Malaria Starts With Me campaign. Through the Kenya Malaria Youth Corps, we are stabilizing our young people and mobilizing them and communities to lead this fight. At home, Kenya has pioneered new models of health financing. In 2024, we launched a new national health insurance framework based on equity, sustainability, and universal access through prepayment. Across Africa, countries like Rwanda, Nigeria, and Ghana are testing health-focused taxes and performance-based financing. Mobile money, fintech, and diaspora engagement are opening new exciting doors. But more must be done. Vigorous domestic and continental resource mobilization is urgent. We must embrace innovative taxes, debt swaps, and blended financing mechanisms in partnership with our development allies. These are not isolated experiments. They represent a continental shift towards models rooted in Africa's own economic realities. At the same time, Excellencies, we must speak truth. We must speak the truth. The global health architecture remains unbalanced. Africa cannot continue to be the last in the line for vaccines, diagnostics, and treatment. Equity is not charity. It is justice. We therefore call for fair pricing, meaningful technology transfer, inclusive research and development, and sustained investment in Africa's manufacturing. This is why Africa's active leadership in the negotiations on the pathogen access and benefit sharing annex of the pandemic treaty is non-negotiable. We must sit on that table. Let it be clear, Africa is not asking for permission to lead. We are already leading, but we seek partnership. We seek partnership that is grounded in mutual respect, shared responsibility, and global fairness. Africa can and must finance its own health future with ambition, innovation, and unity. We can deliver a future where every African enjoys quality, affordable health care financed by Africa for Africa. I say so in context with what we are doing in Kenya. with our own interventions and innovation, we have tripled the budget that is available from our health insurance. Through, again, innovation, working with manufacturers, we have increased availability of equipment, diagnostics, and treatment facilities in Kenya. And that is why I strongly believe that the answers to the health questions that we often ask are with us. Together, let us rise to this moment. Let us prove that resilient health systems are the cornerstone of dignity, security, and prosperity. I thank you for your attention.
Thank you very much, President Ruto, for your strong statement on equity and the need for, as you termed it, inclusive research and development, manufacturing on the continent, fair pricing. Very strong statement for equity, and we applaud you for that. Thank you so much. I'd now like to invite to the panel to speak the Vice President of the Gambia, His Excellency Mohamed Yallo, also a member of the Africa Leaders Malaria Alliance. Vice President, please.
Your Excellencies, distinguished colleagues, ladies and gentlemen, it is a privilege to join you today as we discuss our continent's fight against the ever-increasing threat of malaria. On behalf of His Excellency President Adama Barrow and on behalf of the Republic of the Gambia, I stand before you to reaffirm our unwavering commitment to the goal of eliminating malaria in Africa. We all recognize we are facing an unprecedented financial crisis. Over the past 5 years, official development assistance from donor countries has declined sharply. Over the coming months, the Global Fund replenishment will close. I want to thank His Excellency President Ramaphosa for co-hosting this replenishment cycle with the United Kingdom and for his leadership on this matter, recognizing the Global Fund's importance for the health and well-being of all Africans. The Global Fund replenishment is essential. However, additional international financing mechanisms must contribute to fight against malaria. For 2 decades, international partners, including the World Bank's International Development Association, has funded investments in strengthening health systems. In the Gambia and across many other countries, this funding has helped reinforce local health systems, such as community health workers, and enhance data systems and surveillance. The investment in broader health system has helped support the delivery of critical malaria intervention across the Gambia. Between 2005 and 2010, the World Bank's International Development Association launched its Malaria Booster Program. The initiative committed over $1 billion to malaria control. It helped to scale up proven interventions such as insecticide-treated bed nets, resulting in significant reductions in the malaria burden. Now, with the recent AUDA-21 replenishment making $100 billion available across a range of development issues, we have an opportunity to deliver a similar targeted booster program to to address the challenges we face today. The perfect storm of climate change, biological threats, and humanitarian crisis. Alongside my fellow African heads of state, we urge the World Bank to launch a new AUDA malaria booster program. The case for a renewed program is clear. It will help close our immediate funding gaps for malaria. It will help support the procurement and deployment of next-generation tools. It will help strengthen community health workers' programs. It will help enhance supply chain resilience. And ultimately, it will help defeat malaria. Alongside existing mechanisms, we must explore other complementary methods to fund health in our countries. As official development assistance declines, fresh thinking is required. We must develop public-private partnerships to build the growing resource gaps and accelerate our progress to elimination. Partnerships that can help us deliver sustainable financing at this critical moment and lead our continent to prosperity. The challenges we face are immense. The perfect storm of challenges could destroy our progress, but it does not have to be that way. Your Excellencies, distinguished colleagues, ladies and gentlemen, despite these challenges we face, we can eliminate malaria. Zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with all of us. I thank you for your kind attention.
Thank you so much, Vice President, for reminding us of the critical ends to which funding raised for the effort to eliminate malaria goes. And of course, this is the replenishment year for the Global Fund, so we call on everyone to dig deep for this effort. Thank you so much. We're now going to take contributions from the floor, from designated speakers. And the first I will call on is His Excellency Dr. Jean Kasaya, Africa CDC Chief. Please.
You saw the reaction of President Ramaphosa. He's so happy to see me. Can I take it from here?
Yes.
Thank you.
Yeah, thank you.
Many thanks, Your Excellency, for giving me the floor. Excellencies, President Ramaphosa and President Boko, Your Excellencies who are here in this room, let me bring you back to 26 July 1986. Mike Tyson is fighting Marvis Frazier. With only 4 punches in 30 seconds, Frazier was knocked out. In Africa, when I was watching that game, I was thinking about our situation regarding the health security. The first punch was the huge increase of outbreaks. 41% of increase of outbreaks in 2 years. The second punch, lack of medical countermeasures, vaccines, medicines, diagnostics, including state of emergency in some countries. President Boko, congratulations for your decision to stop with middlemen. But the country, many countries in Africa are suffering because of that. The third one, lack of quality data, even hosted by some partners elsewhere. And when they decided to move on, they took their data, leaving the continent without data. And the fourth one, decrease of ODA. They were thinking that with these 4 punches, we'll be knocked out like Marvis Frazier. Fortunately, we have in Africa visionary leaders like you in this room today. You are showing that this challenge becomes an opportunity for Africa to start to raise sustainable financing, to build our own data system owned by the continent, to start to manufacture our own vaccines, medicines, and to build strong surveillance system. Now Africa is leading the world. Thank you for your leadership, Excellencies. We want also to renew Africa CDC commitment. And President Ramaphosa, you are my champion. You are the African Union champion for pandemic preparedness and response. We see the way working with President Boko, working with President Ruto, and so others, you are leading this continent. Our commitment as Africa CDC is to continue to follow your leadership and to make sure that Africa will not be knocked out with these pensions because you are there, you are leading us. Thank you so much.
Thank you very much, Dr. Kasaya. Do I see in the room Nardos Bekele-Thomas of NEPAD? Not yet. Do I see in the room the Executive Director of UNFPA? Yes. You have the floor, Ms. Deanne Cater, and congratulations on your recent appointment as Executive Director.
Thank you so much, Your Excellency, Right Honorable Ellen Clare, Chairperson of this fantastic session. Excellencies, Mr. President, and all protocol observed for everyone else with a lot of respect. I would like to speak here not only for UNFPA, since I don't see my sister Katie Russell of UNICEF in the room, nor Tedros, on behalf of the three of us, because I think they're not here. So allow me to say that it's an honor to join the many esteemed leaders here today committed to the health and well-being of women, children, and adolescents. Not long ago, during the TCAD Africa, we heard President Ramaphosa brilliantly explain about sexual reproductive health and rights. Thank you for that, Mr. President. And under your visionary leadership, the Global Leader Network has emerged and as a beacon of hope in a time of turmoil. The health and rights of women, girls, and young people underpin the peace and stability that we all depend upon. Sexual and reproductive health and rights leads to more empowered women, healthier families, and more prosperous societies. In crisis setting, it can spell the difference between life and death. Whether it is through emergency obstetric neonatal care or availability of nurses, of midwives, or establishing norm, UNFPA, UNICEF, WHO, and all sister agencies, we are committed to save and transform lives. That's what we do everywhere. So my message, or our message to decision makers present today, is this one. Let's recommit. Let's recommit to fight against all preventable death with a focus on vulnerable people. Let's unite behind the fight against malaria, which remain a top killer for vulnerable women, children, and adolescents. And let's not forget that sexual and reproductive health is a best buy for development and one of the smartest, most cost-effective investments any government can make. When we invest in women and children, everyone gains. I commend all of you, leaders of African countries, shoring up domestic financing for health and the work of the Global Leader Network, the African Leaders Malaria Alliance, and other critical health initiatives on the continent. With your political will and support, we can ensure health, dignity, opportunity for every woman, every child, every adolescent, and indeed everyone for generations to come. I thank you for your kind attention.
Thank you very much to the Executive Director of UNFPA, speaking also for UNICEF and the World Health Organization. And last of this segment, can I call on Dr. Sanya Nishta, the CEO of Gavi, the Vaccine Alliance. Dr. Nishta, you have the floor.
Thank you, Chair. Right Honourable Helen Clark, Your Excellencies, Mr. President, all protocol observed, thank you for bringing us together today because we are at a critical inflection point. Today, we risk a disorderly collapse of essential support to the world's most vulnerable communities. So it is timely that there are conversations about a new global health architecture at this UNGA. We need a new ecosystem that supports countries and stands behind them. There is a need for alignment on the objectives of such an exercise, clarity on principles, and agreement on the process. At Gavi, the Vaccine Alliance, we are already preparing for this new global health ecosystem. We are well on the way to implementing our new transformation called the Gavi Leap, with country centricity at its core. We strongly believe countries and not in global health institutions should be at the center of global health, and we have translated that belief into concrete actions. From January onwards, the Gavi Leap will increase country decision-making authority over use of resources. We are rethinking every aspect of our work to provide the simplicity and flexibility that governments require. We also appreciate that you wish to tap into innovative financing and that you wish to strive towards self-sufficiency, which is exactly why we have launched the MDB Multiplier, which will unlock resources and concessional loans for Africa-led initiatives. And this is also why we have launched the African Vaccine Manufacturing Accelerator, a $1.2 billion facility to promote African self-reliance in vaccine manufacturing. By committing to concrete reforms, we believe we can build a more responsive and country-led global health architecture. And this can form the basis of what we might call a global health leap. And I want to assure you that Gavi stands ready to play its part, and we invite partners to join us in this transformative journey. Excellencies, let me also thank you for all your support for the Gavi replenishment. 80% of the 9 billion raised will come to Africa. And I'm also pleased to let you know that we are currently implementing the fastest vaccine rollout in Gavi's 25-year history. This is the rollout of the malaria vaccine. 23 African countries have adopted the malaria vaccine to date. The malaria vaccine introduced alongside long-lasting insecticide-treated nets and seasonal chemo prevention reflects the power of global collaboration. And I'm pleased to let you know that the vaccine has shown a 13% drop in all-cause child mortality in vaccinated areas. Excellencies, let me assure you Gavi remains committed to supporting Africa's priorities. Through the Gavi Leap, we are shifting power to countries in line with your vision of health sovereignty. With your continued leadership, we can ensure immunization is not only sustained, but strengthened as a pillar of Africa's resilience and preparedness. I thank you.
Thank you very much to Dr. Nishta from Gavi. We now have with us Nados Bekele-Thomas, who is the CEO of AUDA-NEPAD, African Union Development Agency, New Economic Partnership for African Development. Nados, where are you? Front row. Thank you.
Thank you very much. Can you hear me? Yeah, thank you very much. My former boss, Madam Helen Clark, so wonderful to see you. Your Excellency, Presidents of, South Africa, my host country, and also the President of Botswana. Excellencies, ladies and gentlemen, I think, I'll be short because this is really more for others to really reflect. My job is to take the recommendations of this and to try to put it into action and implement. First of all, I would like to congratulate and welcome the Global Leaders Network, which is led by His Excellency President Ramaphosa. This is certainly a significant signal of strong political will to recommit governments to addressing women's, children's, and adolescents' health and rights, and should be supported by private sector, philanthropy, and all sectors of society, because certainly we've been saying that health is life, but health is also wealth. And if we address challenges of women, children, and adolescent health, we effectively address more than 75% of our health system. So this sector is important for strong health systems, but also for driving socioeconomic development in the globe, and more so in Africa, where, you know, the world's youngest youth, the youngest population, is projected to get even more young, with an unexpected 2.5 billion by 2050, and with more young Africans entering the workforce each year than the rest of the world, where we have a health financing gap of over 66 billion annually to achieve universal health coverage. But this is an opportunity. This is a market for the private sector. And where Africa, in Africa, where we import more than 80% of our medical products, and where the need is greatest to reach poorest and most vulnerable and those affected by humanitarian crisis. This is why, as the African continent's premier development agency, the Africa Union Development Agency, we're driving, you know, some of the programs that are of critical and catalytic nature. We recently launched, with the support of my sister who's here, our catalytic program, the African Demographic Dividend and Sexual and Reproductive Health Program, in over 11 countries and 6 regional economic communities, with the view of expanding to reach all countries and all regs on the continent. This is $100 million investment over the next 5 years, aimed at driving high-level advocacy for SRH and harnessing Africa's demographic dividend, accelerating health financing through our program for investing financing Africa's health, the PIFA, which has called 4 hubs in the different sub-regions, and these hubs are just there to mobilize domestic resources for the same purpose, and building Africa's industrial base to ensure local manufacturing through the 24 priority medical products which we have already identified with all the stakeholders. And out of these, 75% of these medical products are for maternal, newborn, and child health. And, you know, and more than that, you know, we're also doing some strengthening of capacities in terms of really making sure that governments respond to these challenges in a very integrated, holistic, coordinated manner, and making sure that the policies are really also cohesive, and, you know, and in most cases, we know that one policy contradicts the other one. We are making sure that all policies of governments really are coherent and they reinforce each other. And finally is the expanding our health workforce, especially community health workers, anesthesiologists, and midwives, among others. Lastly, our interventions are also in addressing HIV/AIDS and social and behavioral change amongst youth and adolescents, especially focusing on the boy child. Especially, Excellencies, your agency, the Africa's Premier Development Agency, support the work of the Global Leaders Network. We pledge, you know, to do that. That's our job. Whatever you ask us to do, we are there to implement. And we look forward to building with you, Your Excellency, President Ramaphosa, this program, and we join your call in inviting private sector, philanthropy, and critical players in the health ecosystem to work together in strengthening Africa's health agenda through partnership grounded on shared goals accountability, solidarity, and sustainability as we build the Africa we want. I thank you very much, Your Excellencies.
Our last speaker will be Professor Sinai Feseha, champion of sexual and reproductive health and rights. And you will issue, Sinai, a rallying cry, I'm sure. Over to you.
Excellency President Ramaphosa, Excellency President Boko, Excellency VP of Gambia, the Right Honorable Helen Clark, delegates, colleagues, all protocols observed. President Ramaphosa, I personally want to thank you for your steadfast leadership as one of the continent's strongest champions for women and girls. Please, a round of applause. And President Boko, for how quickly you've taken up the mantle of some of our most intractable challenges like malaria, as well as women, children, and adolescent health. We're grateful to all of you. As so many of you mentioned in this forum and in others, this has been an incredibly difficult year. But I'm leaving the session feeling very, very hopeful. This moment presents an opportunity to move towards what we have long desired: greater self-reliance, independence, and ownership of our health systems and the continent's development agenda. And in doing so, we have an opportunity to ensure they reflect our values. What we believe in is right and is needed for our people. One of the challenges about being an African woman or girl is that your fate is so often tied to someone else's decision. Whether you have access to an insecticide-treated bed net, whether you will be safe from child marriage or gender-based violence, whether you can access contraception or safe abortion or deliver safely, all the things you need are not within your control. Things like reproductive health have become political footballs without taking into consideration we're talking about our women and girls' lives. And these services, combined with the other topic that we have put today, prevention of malaria, especially malaria and pregnancy, are our only hope to reducing the scourge of maternal mortality. So why do we allow them to be controversial? I mean, I honestly just don't get it. I don't know how this is political. I don't know how this is religious. I really can't comprehend. And for so long, we've said it's somebody else's agenda. It's not. I'm telling you, as a woman and girl from the continent of Africa, it is our agenda, and it's in the leaders of our hands. You know, my dear mentor and friend, the late Mahmoud Fatala, once said, "Women are not dying of diseases we cannot treat. They are dying because societies have yet to make the decision their lives are worth saving." We have all the tools we need, not just to save women and girls, but to allow them to thrive. Our rights are enshrined in member state negotiated documents like the Maputo Protocol, and thanks to the leadership of His Excellency President Ramaphosa, now the Convention on Ending Violence Against Women and Girls. What remains is action. And action starts with leadership at the highest level of government, and that's what we're seeing here today. Excellency Presidents, I want to commend what you are doing to take on these tough challenges head on, and we at the Foundation are so fortunate to partner with you all, and we see your work and your leadership in action every day, not just when we come to the halls of the United Nations in Geneva and New York and the cities. We see it on the ground where it matters, frankly, where lives are being translated. So for me, the impact I have seen in the 17 African countries I am working with directly with government, the progress we've made in changing policies and service delivery and expanding access to the most vulnerable, and the scale of it has been unmatched. So I want to take this moment to thank the leaders that are not in the room, but are doing all the right things to advance the health, well-being of women and girls across the continent. And I know there is much more to do. So building on what we heard today, I want to leave the room with 3 calls to action. First is setting more ambitious wins. Why would we settle for an SDG target of 70 maternal deaths for 100,000 live births? Every country should aim for 0 preventable maternal death, because that is possible. Second is to identify and reduce policy barriers preventing women, children, and adolescents from accessing life-saving services. And excellencies, we have great examples on the continent, from South Africa to Rwanda, from Ethiopia to Benin. Governments are putting these policies. And third is staying true to our priorities and our values and our relenting focus on what we need to help our women, children, and adolescents thrive. For far too long, others have decided their fate. And as President Ruto said before he left, clearly Africa is not asking to lead. We are already leading, and the answers to the questions we have are within us. And excellencies, presidents, partners, with our continued combined effort, with the leadership of the heads of states, your commitments, we can create a continent in which every woman, every girl, every child can live to her fullest potential. And as the daughter of the continent, I will tell you what happens when a woman can access education, when she can avoid female genital mutilation, when she survives child mortality before age 5, when she's not forced to marry, when she can have access to contraception and safe abortion and safe pregnancy care. The end result is women that are unstoppable. So thank you very much for your unparalleled leadership on this. Thank you.
Thank you, Professor Touray. And it falls to me to make very brief closing comments and to say to President Ramaphosa and President Boko, you have great convening power. A large audience has come today to hear your call. And wonderful to see the audience come from your region, but also beyond, with great interest. So as Professor Touray said, it's a hopeful meeting. And we all take hope from the stand you've taken to mobilise finance, to take control, to take ownership. I think it's been really extremely exciting, including those bold commitments for looking for new ways to finance, all tools, instruments, everything's on the table around the cause that we've come here to talk about, our women, children and adolescents, and of course eliminating malaria. So thank you to their excellencies for their leadership. Leadership is everything in these matters. And thank you to such a large audience for coming to hear their talk on these very, very important matters. With that, I conclude the meeting. Thank you.